One of the deadliest outbreaks in Canada's COVID history is unfolding now in Winnipeg. Infections among staff starving the home of workers, leaving residents inside dehydrated and dying.
Tell me how they're doing, what you know about how they're doing.
Speaking on Rosemary Barton Live, Alvin Kodonic cried out for help for his aunt and uncle inside.
It's sad and difficult and terrifying. All you can do is yell and scream and hope that somebody does something to correct it.
In Ontario's Rockcliffe home, it's too late to get residents to safety. More than 80% have COVID now, 66 staffers too.
It's totally predictable and preventable.
But, says geriatrician Nathan Stahl, don't blame the workers, who are the likely source of transmission. Blame a province-wide staffing failure.
The workers overwhelmingly are women, have overwhelmingly not had full-time jobs. They may work in grocery stores or take on other jobs to make ends meet.
The second urgent task, he says, is to end the infection control nightmare of 3- and 4-person rooms. Dr. Stahl says government should decongregate people into empty hotels, even climate-controlled tents.
In Ontario, where a number of the big explosive and deadly outbreaks have happened, they've occurred in these older homes that continue to have occupancy in 3- or 4-person rooms.
Those rooms are more common in for-profit facilities, where a recent study found COVID, once in, was more likely to spread inside. And CBC News has learned a new complaint to Ontario's Integrity Commissioner alleges government MPPs have received political donations from the long-term care lobby, putting those politicians, it says, in a conflict of interest, just as the government is rushing the passing of Bill 218, which benefits those donors and companies by protecting them from certain lawsuits over COVID. The Ontario Health Coalition is behind the complaint.
That policy reflects the interests of the for-profit long-term care industry at the expense of the public interests and the interests of the residents and their safety in long-term care homes.
The Ford government has not yet responded to the complaint. One thing that is clear, the more present COVID is in our community, the more prevalent it will be in our nursing homes, and the more vulnerable people who will get sick and die. David Common, CBC News, Plevna, Ontario.